Next, I'm going to introduce our associate editor, Dr. John Kirchie from Vanderbilt. Dr. Kirchie.
Well, it's fantastic to be a part of this. Thank you very much, Alan, for putting this together, and Dr. Glavitsky for supporting this new journal and what we're presenting here. And this is a great time because we get to highlight in our brand new journal some of these fantastic new science articles that we've been able to publish that really, I think, are quite remarkable in their quality. And so I really appreciate the authors for coming on here and giving us some additional insight and reviewing their findings with us. Our first paper today is from the University of California in San Francisco and the San Francisco Veteran Affairs Medical Center, and is entitled Circulating Exosomes from Patients with Peripheral Arterial Disease Influence Vascular Cell Migration and Contain Distinct microRNA Cargo. And it'll be presented today by the senior author, Dr. Michael Conte. Thanks.
Thanks, John. Thanks, Alan, for the opportunity to do this, and congratulations to you and the editorial team, and to Peter and the vision of JVS to create this journal. I think it's really exciting, and we are appreciative of the opportunity to present our work. I'm actually going to introduce the first author of the paper, Dr. Tom Sorrentino, to present the work. Tom was a postdoc in my lab at the time when he completely orchestrated this project and executed it from start to finish. He's now an intern in our general surgery residency program and a budding superstar in vascular surgery. So, Tom, why don't you take it away?
I apologize in advance if my pager goes off. All right, so thank you everyone for the opportunity to present our work and for the opportunity to have this published in the inaugural edition of the JVS Vascular Science. So you can see our visual abstract here, and I will just launch right into the presentation. So for background, exosomes are nanometer-sized vesicles that are released by all sorts of cells throughout the body and carry a variety of cargo that have signaling implications, including proteins, various non-coding RNAs, and of particular interest to us, microRNA. And the content of the exosomes that are released by cells are significantly influenced by the surrounding milieu, which is to say that patients in various disease states release exosomes with different contents. The primary way by which exosomes influence signaling throughout the body is that they have effects on target cells, both in a paracrine fashion and at a distance throughout the body. And primarily research in vitro models has shown that exosome-based signaling has known effects on atherosclerosis, angiogenesis, and processes involved in neointimal hyperplasia. And so in our study, we had two hypotheses. First, that circulating exosomes in peripheral arterial disease subjects would influence key processes in vascular remodeling. And second, that exosomes from PAD subjects contain distinct microRNA profiles that correlate with clinical severity. As far as our methods, there were 3 patient groups. We took banked plasma samples from 6 healthy patients, 6 patients with mild peripheral arterial disease, and 6 patients with severe peripheral arterial disease, which was either disabling claudication or rest pain. And we isolated the exosomes using a novel density gradient cushioned ultracentrifugation technique developed by Dr. Robert Rafai's group here at the San Francisco VA. And from there, we use these exosomes to perform functional assays of vascular cells, including vascular smooth muscle cell migration, endothelial cell migration, and M1 and M2 macrophage gene expression in human monocyte-derived macrophages. And then finally performed targeted exosome microRNA profiling using qPCR, and we selected an abbreviated panel of microRNA that through literature review have been known to have important effects in vascular remodeling processes. So moving on to our results. First, we found that exosomes from PAD patients increase smooth muscle cell migration and decrease endothelial cell migration in vitro models. And so here we applied exosomes from healthy patients, patients with mild PAD, and patients with severe PAD, and saw in figures A and B that this vascular smooth muscle cell migration significantly increased as the severity of peripheral arterial disease increased. And in figures C and D, we see the opposite effect when these exosomes are applied to endothelial cells, suggesting that they may play a role in these important vascular remodeling processes. Next, we applied these exosomes to human monocyte-derived macrophages and looked at M1 or pro-inflammatory and M2 or pro-resolving gene expression profiles in the macrophages. Interestingly, we found that while there were some alterations in M1-related TNF-alpha and MCP1, this did not correlate specifically with clinical severity of peripheral arterial disease from the donors for the exosomes, and then there was no significant patterns seen in M2-related gene expression in this study. And then finally, we performed a cluster analysis of the 20+ microRNA that we profiled for, and found that the healthy patients with mild PAD and patients with severe PAD, the microRNA clustered into distinct groups, and notably there were significantly increased levels of microRNA that are known to have pro-inflammatory effects in patients with severe PAD, including microRNA 181b, microRNA 21, 92a, and 126. So in conclusion, this preliminary pilot study demonstrates that exosomes from PAD patients negatively influence key processes in normal vascular remodeling after an injury, and that exosomes from healthy subjects and those with increasing severities of PAD contain distinct profiles of immune regulatory microRNA. And thus we propose a system as diagrammed on the right, whereas patients who are healthy and those with PAD at baseline have different circulating exosome phenotypes, and in the setting of a vascular injury, the signaling processes that are influenced by these exosomes may have important implications in both in vitro vascular remodeling and then clinical surgical healing. So thank you for the time, and if there are any questions, I'd be happy to answer them either now or at the end of the seminar.
There's the pager right on time. Okay, that was fantastic. Great talk. I do appreciate all the effort you put into this. This is really amazing. I forgot to mention at the beginning, I do want to encourage everyone to post questions into the Zoom group chat. And I'll then ask them of each presenter as we go through. I'll ask a few questions here. So really well done. Let me start with a question from one of our associate editors, Dr. Ulf Hedin. Could you tell us something about the stability of the exosomes and their content?
Yeah, so this has been studied by our collaborators, and we've seen that at least looking at microRNA, that the exosomes are, if processed properly, are stable in the standard sort of -80 freezers that most labs have for 4 to 5 months at least at a time, and they're doing ongoing studies to see sort of what the longevity is of the proteins and other non-coding RNA that are contained within them. But we think that they're good for at least several months from initial harvest.
Excellent. I have a question while we're waiting for anybody else to bring up questions. I noticed that in your inclusion and exclusion criteria for these patients, there was an emphasis on making sure that patients weren't taking any immune modulation, and in fact, the control patients weren't even allowed to have been on aspirin. So that suggests that there's a lot of these microRNA profiles are easily modified by these medications. What do you think about that, and how should we use that to interpret the results you have?
Yeah, so that certainly is something that has confounded this study to a certain extent. And there is, if I recall, a paper or two that has specifically looked at the role of statins in altering the content of exosomes. So it is certainly something that should be taken into account in future studies. It is, I think we found that when we were enrolling patients, it was somewhat difficult to find exactly well-matched patients who were both on an aspirin and a statin, but also didn't have concomitant vascular disease.
John, as a quick follow-up, and possibly as a little bit of a teaser, I'll also say that, not presented here, but Tom has done a study looking at exosome changes after short-term dietary manipulation and with marine oil. And there is a dramatic remodeling of the exosome content with changes even in nutritional supplementation. So they are actually quite dynamic, and this is why this is a sort of pilot study for us in terms of hypothesis generating work.
Excellent, very exciting. I've got one more question that's been posted. Could you speculate on how early these exosomes change their phenotype in relationship to patients with developing peripheral arterial disease?
I think that it's hard for me to say specifically. I do think that is something that could be studied very more cleanly in, for example, a mouse model where you could very cleanly see what the progression of atherosclerosis is in those mice, and then look at the phenotype of the exosomes over time. And so I think that would be somewhat challenging to do in a clean way in humans, but certainly something where you could probably gain a lot of useful information in an animal model.
Excellent. Thank you so much. Well, that was a great talk and an awesome start to this discussion of some of these papers that we get through the JVS Vascular Science.